So in my perspective, a transplant clinical pharmacist is someone who is a specialist in immunosuppression medications. But in addition to that, since you have to take care of the whole patient and not just the graft, you also have to be well versed in internal medicine, critical care, and infectious diseases. And you also have to be able to manage pharmacotherapy and assess pharmacotherapy in all stages of the transplant process. So before the transplant, during the transplant admission, and then after in the long term, with the goal of protecting the graft but minimizing all the side effects and complications. And when we refer to the graft, we're referring to the transplanted organ that the patient has received. I have been a transplant clinical pharmacist for the past 5 years since August of 2008. I became a transplant clinical pharmacist for many reasons. First of all, I found that you got to work in many different areas within one specialty of practice, being transplant, because in taking care of just one patient, you manage infectious disease, critical care, internal medicine, multiple different issues for every patient that you're taking care of. In addition to that, you are constantly interacting with a multidisciplinary team and with the patients, and you follow the patient through the whole transplant process from before the transplant until after they get their transplant. So it's very rewarding to do that. And in addition to that, transplant is a very fast-paced field where you're always learning something new every day. The educational route that I took to become a transplant clinical pharmacist was after I completed my Doctor of Pharmacy degree from Nova Southeastern University, I then went on to do a pharmacy practice residency at Broward General, which was a joint residency between Broward General and Nova Southeastern University. And during that year, my longitudinal experience was in the liver transplant clinic, which is where I had most of my transplant training. So my typical day as a transplant pharmacist usually begins with arriving at the hospital around 6 a.m. And then at that time, I would be catching up on any overnight occurrences or any new transplants and beginning to look at the labs and medication profiles, cultures, things like that for all of the patients that are on our census for the day. And then around 7:30, our patient care rounds start, which consists of a morning report from where one medical resident signs off to the next medical resident. And also in morning report would be pharmacy students, medical students, observers, and our transplant surgery fellow. After that meeting, we will do walking rounds and see all of the patients, where I would help the medical residents to make sure that all the orders that we discuss are entered appropriately. And after we complete that, which takes a couple of hours, we would begin discharge planning. So preparing all the patient's medications for discharge, and then providing medication education to the patients before they leave. In the afternoon, the activities could vary depending on the day, but usually it would consist of some topic discussions with students, or in transplant we have a lot of multidisciplinary meetings. Some of the meetings include a selection committee meeting, which is where we review the patients that are about to be listed for transplant. And we also have a morbidity and mortality conference to review interesting cases, and also some clinical pharmacy meetings. So depending on the day after that, I would catch up and make sure that everything that we discussed from rounds was entered appropriately. And sometimes in the afternoon, we may round again with our transplant attending physician. And that's pretty much it. And any other free time I have is usually spent catching up on new journal articles or trying to find time for my own personal research. So the best advice that I could give to somebody that's in pharmacy school or entering pharmacy school that is interested in becoming a transplant pharmacist would be to make the most out of your rotations, both as a student and a resident. And in addition to that, it's important to keep in mind that transplant's a little bit unique because there's not a transplant program offered at every hospital. And as a matter of fact, there's only usually a few, if any, in each state. So it's important to keep in mind that it's a very competitive field. That being said, I would plan on completing a 1-year pharmacy practice residency and continue on to complete a specialized 2nd-year residency in solid organ transplant. It's also important to do your research on the various pharmacy websites like the ASHP website or the American College of Clinical Pharmacy website to see which hospitals and which centers offer specialty residencies in transplant so that you can start making connections early. And again, the most important thing would be to make the most out of your rotations and learn as much as you can.